Hello, I'm Ohio Governor Mike Dewine. Welcome and thank you for joining us today for this important webinar. Ohio is on the road back. Thanks to vaccines and thanks to your efforts, we're getting back to the things we loved doing before the pandemic. Together from the very beginning, we have been committed and consistent about prioritizing older Ohioans in our fight against COVID-19. That has been apparent through your hard work in facilities and also throughout the state of Ohio. The vast COVID-19 testing program for long-term care facilities has helped us identify and prevent additional spread of the virus in our nursing homes. Ohio worked to get PPE to care facilities even when the nation faced great shortages. We also made nursing home and assisted living residents among the first in the state eligible for the vaccine. As vaccines became more widely available, we ensured that all older Ohioans had access in what we then called Phase 1B. Efforts continued through programs such as the senior housing vaccine clinics and homebound efforts. Ohio also moved quickly and was the first state in the country to put in place a vaccine maintenance program for our nursing homes and assisted living facilities to ensure that every single staff member and resident had an opportunity, a continuous opportunity, to get vaccinated. Throughout the last year, we have worked diligently to ensure health orders struck the important balance between protecting physical well-being and mental well-being. That balance has been center stage for many of the discussions and decisions made with medical experts. As the community spread finally started slowing down thanks to the wide availability of vaccines in Ohio, we updated those orders once again. Now is the time when we transition from orders to guidance. The orders outline what should be done, but now you know how to protect older Ohioans and how to incorporate those best practices into the daily operations of your facility. Ohio continues to make tremendous progress on our road back, but you must continue to be vigilant. Now, we are still seeing some outbreaks. They're certainly fewer than they were before, but they are occurring. And as our nursing homes, assisted living open up with increased interaction, and comes increased risk of additional infection. So please continue the safe and healthy protocols. Mask up in healthcare settings, mask up elsewhere. If you're unvaccinated, get vaccinated. Continue good cleaning practices and reduce the chances of illness by holding activities and visits outside whenever possible. We're trusting you to continue the important work of protecting those who have been most impacted by this virus. We're looking to you, the leaders of our nursing homes, our assisted living facilities, our adult care services, and senior centers, to help lead the way into the next phase of the pandemic. I know that the last 16 months has been very tough, and very tough for you. It's been a strain on resources and a strain on you emotionally. Thank you for your dedication. Thank you for your compassion. Thank you for making Ohio the best place to age in the nation. We are a better, stronger, healthier Ohio because of you.
Thank you, Governor Dewine, and thank you all for joining us today. My name is Ursel McElroy, and I am the Director of the Ohio Department of Aging. It has now been a year since the beginning of what is arguably the largest public health emergency most of us will experience in a lifetime. COVID-19 took aim at older adults, threatening their health, their needed services, their interactions with loved ones, and their lives. Throughout, you have been called upon to be brave, flexible, and resilient, among other things, and I thank you. While we are still in the midst of the pandemic, I am encouraged that we have opportunities like today to begin restoring the critical connections we all very much need. Ohio is on the road back, averaging less than 50 cases per 100,000 people. Effective June 2nd, Governor Dewine lifted the vast majority of public health orders, and most recently on June 18th, the state of emergency was lifted. During this hour, we will address the assisted living visitation order, testing order, CDC guidance, compliance, the Regional Rapid Response Assistance Program, and so much more. This time is dedicated to you. We have a panel of experts available to address questions for you. During this session, lines will be muted, but feel free to use the question function. We will make every effort to post helpful information, tools, and resources to address any questions you might have today. I will be joined by experts in post-acute and long-term care medicine, Doctors Marla Howler, Stuart Cantor, Thomas Lehner, and John Wigan. We'll also be joined by our featured speakers, Rebecca Sandholt, Chief of the Bureau of Survey and Certification for the Ohio Department of Health. And again, Dr. John Wigan, Chief Medical Officer of the Regional Rapid Response Assistance Program, or RAP, which you will hear more about later. Today, I will also be joined by my colleague, Dr. Bruce Vanderhoff, Chief Medical Officer of the Ohio Department of Health. And now a moment to discuss visitation. Since March 22, 2021, facilities have operated under the amended director's order to permit access to Ohio's residential care facilities with exceptions. Derived in part from the core principles and guidance from the Centers for Disease Control and Prevention, or the CDC, the order was prescriptive to support safe management of operations, capacity, and flow. It required facilities to allow indoor visitation at all times for residents, regardless of vaccination status, except in circumstances when visitation should be limited due to a high risk of COVID-19 transmission. To help control the capacity and flow of visitors, scheduling visits in advance, specifying the number of visitors per resident per visit, limiting the amount of entry points, designating visitation spaces, and requiring escorts were examples of state regulations that are now ending. Effective June 18, 2021, the order was rescinded. State regulations on how visits can occur have ended. For example, the state will no longer require advanced scheduling for visitors or limit the number of visitors a resident can have at any time. However, it will be important for each administrator to consider what is best for his or her residents, staff, families, and community. Although the order has been rescinded, it remains incumbent upon you as leaders to ensure sound clinical and safety practices, including how to manage capacity and flow safely. Visitation can be conducted through different means based on a facility structure and residents' needs. Some considerations: physical layout to safely distance and move about the facility, location of visits such as in resident rooms, dedicated visitation spaces, indoors, outdoors. Also, what visitation looks like for circumstances beyond compassionate care. You are strongly encouraged to continue evaluating the case status within your community, case status in the facility, staffing levels to support your plans while maintaining resident care, access to adequate testing for residents and staff, personal protective equipment and supplies, and local hospital capacity. It will be important to evolve your visitation policies in a way that is consistent with the prevailing CDC guidance. Educating residents and visitors about the risk of the spread of COVID-19 and the appropriate safety measures to take to protect themselves remains important. And having a sound testing strategy for staff and residents to support early detection of COVID-19. Regardless of how visits are conducted, there are core principles and best practices that should be integrated in your operations to reduce the risk of COVID-19 transmission. Assisted living facilities shall carefully consider all implications for resident physical and mental well-being when determining how to facilitate visitation. There are core principles that should be adhered to at all times. They include screening all who enter the facility for COVID-19, exercising good hand hygiene, utilizing face coverings or masks appropriately, social distancing at least 6 feet, posting instructional signage throughout the building, cleaning and disinfecting high-touch surfaces, insisting upon appropriate staff use of PPE, effectively cohorting of residents, and having staff testing and resident testing conducted properly. According to the CDC, they have created guidance specifically for nursing homes, but content might also be informative for assisted living facilities. Interim infection prevention and control recommendations to prevent SARS-CoV-2 spread in nursing homes summarizes the core infection prevention and control practices for nursing homes and long-term care facilities during the pandemic. Some of the recommendations can be modified in response to the vaccination. Modifications will be regularly updated in the document entitled Updated Healthcare Infection Prevention and Control Recommendations in Response to COVID-19 Vaccination. A bit about testing as vaccination coverage continues to pick up both inside the facilities and throughout the communities. I'll spend the next few minutes addressing the current state requirements and a new self-service tool to assist with ordering tests, reporting results, and requesting vaccine support. The director's order for the testing of the residents and staff of all residential care facilities was updated May 4, 2021, to require routine testing of all unvaccinated staff at least twice per week. Fully vaccinated staff do not have to be routinely tested. And regardless of vaccination status, strategic testing of all staff and residents shall continue. This can include testing staff and residents with known or suspected exposure, testing symptomatic staff and residents, or testing staff and residents as determined clinically necessary. As of today, this order remains in effect and adherence is expected and required. And while there is excitement about the progress made, we must be vigilant about using the tools we have appropriately. COVID-19 tests have been and remain important in our effort to swiftly detect cases and take action. This is a good opportunity to emphasize and to describe the concept of fully vaccinated. Fully vaccinated for our purposes today refers to a person who is equal to or more than 2 weeks following receipt of a second dose in a 2-dose series, or a person who is equal to or more than 2 weeks following receipt of 1 dose of a single-dose vaccine. This is an important point to note, as some staff and residents may be at the midpoint of a 2-dose vaccine, in which case they would not be considered fully vaccinated yet. State support will continue for testing efforts. And while state support is optional, adhering to the testing requirements set forth in the order and related guidelines is not. We have several options for testing. Option 1, alternating PCR and rapid antigen tests. Option 2, rapid antigen test only. Option 3, PCR test only. And option 4 is to opt out of state support. The COVID-19 Care Center is scheduled to launch June 28, 2021. This online portal has self-service functionality that can be easily accessed from our website with key functions consolidated in one place for easy navigation. Logging into the COVID-19 Care Center portal is easy and requires one sign-on to access all the functionality. Facilities with an existing vaccine maintenance program login will be able to use the same credentials to gain access. For those facilities without an existing login, your credentials will be sent alongside instructions next week. Each facility receives one login, so that several people within the facility can utilize the COVID-19 Care Center portal. Once authenticated, you can make selections to update your facility profile, complete weekly testing reporting, manage your state-supported testing options, and manage your vaccine maintenance program options. Additional features include indicators to alert facilities that their profile has not been updated in 30 days. This feature is a helpful prompt to update any point of contact changes, staff and resident census, or other pertinent information. There are also indicators that confirm required test reporting has been submitted. And for quick reference, the opt-in status for testing and the vaccine maintenance program are displayed along with the next vaccine clinic date. Testing program selections can be made at any time through the COVID-19 Care Center. Capabilities include aligning testing selections on shared campus settings, selecting and where needed, changing the preferred testing dates at any time, selecting and where needed, changing the program options at any time. For example, selecting antigen and PCR testing 1 month and perhaps antigen only the next. Selecting where needed, changing the lab selection. And if you elect to change the lab, a notification will be sent to the lab and to your facility point of contact. Vaccine maintenance program selections can also be made at any time through the portal. Once selections are made, once again, an email notification with selection details will be sent to the facility point of contact and the pharmacy that provides vaccine to the facility. Finally, testing reporting will be available. Upon submitting the weekly report, an email with selection details will be sent to the facility point of contact. In terms of next steps, once the webinar series is complete, all facilities will receive a welcome communication from our Covet team introducing them to the portal, a user guide document, and directions on how to validate your credentials, confirm the accuracy of the baseline profile information, and who and how to contact someone for assistance. We will monitor which facilities sign in and follow up with those who do not. Again, Monday, June 28th, we will launch the portal. And what this means is facilities will be able to self-select your testing and vaccine enrollment selections, lab and or vaccine provider, and self-order testing supplies. You'll also be able to update reporting information in the portal, and facilities, labs, pharmacies will begin receiving automated notifications from portal activities. We know that by increasing the number of residents and staff who are vaccinated, we can greatly reduce the risk of COVID-19 outbreaks in facilities, which helps protect the residents, the staff, and their families. Late February, we launched the COVID-19 Vaccine Maintenance Program for nursing homes and assisted living facilities. This program makes it possible for facilities to continue offering the vaccine to employees and residents who chose not to receive the vaccine earlier, but now want it, as well as offer the vaccine to new employees and new residents coming into the building. To date, 1,569 licensed facilities have opted into the program. 177 have opted out of the program, yet they have made us aware of how they receive vaccine from an alternative source. More than 3,560 clinics have been completed and reported in the vaccine maintenance portal. Again, if your facility is in need of vaccine, please utilize the maintenance program. So it's my pleasure to have with me today Dr. Vanderhoff, the Chief Medical Officer of the Ohio Department of Health. Dr. Vanderhoff, you have been instrumental during this pandemic, coming aboard in the fall and serving as one of Governor Dewine's principal advisors on COVID-19. It has certainly been my pleasure to work alongside you, and I have simply been fascinated by your vast medical expertise and collaborative approach to getting things done. Now, when you arrived, we were bracing for an anticipated spike in COVID-19 cases. The vaccines were not yet available to us, and we entered December with the infections and deaths continuing to climb. Then, mid to late December, the vaccine arrived, and Governor Dewine made the critical decision to prioritize congregate settings, in particular, those settings that serve older Ohioans, such as our nursing homes, assisted living facilities, and soon after, Ohioans aged 65 and older. Most of us understood that if we were to have a chance to reduce the infection rates and deaths, we would have to work tirelessly to vaccinate residents of nursing homes, assisted living, participants of our adult day and senior centers, and older adults in affordable housing communities and other independent residential clusters. Our cases began to plummet, and the desire to relax visitation restrictions mounted. For some, nearly a year had passed without regular personal contact with loved ones. Recognizing the benefits, measures were put in place to balance the two safely: physical health and emotional well being. Now, while we appreciate that with every visitor and every worker, there is a risk of exposure, particularly from those who are unvaccinated. So, while cases and deaths have declined sharply this year, there is still a risk. So, please tell us, are we ready to take this risk?
Well, thank you so much, Director McElroy. There's no question that earlier this month, June of 2021, Ohio achieved a benchmark that we have been looking forward to for some months. We are now reporting fewer than 50 COVID cases per 100,000 residents, a place we haven't been since June of 2020. Reaching this benchmark really is a positive sign, a sign that Ohio continues to move forward into a new phase of the pandemic. We're seeing daily cases of COVID-19 fluctuate in the low hundreds, whereas we are seeing cases, nevertheless, that are reported in the thousands each day when we look back to the peak of the pandemic. So it's a big improvement. It's a really welcome improvement. And as you alluded, I think we can largely attribute these improved case rates to our vaccines. Quite simply, the COVID-19 vaccines are working, and they're working very well. And since vaccines became available for older Ohioans and are now widely available statewide, we are thankfully seeing fewer and fewer cases, fewer hospitalizations, fewer deaths, both in our nursing homes and in our other congregate living settings statewide. So one could really ask rightly, well, what about masks and other precautions? Can we be done with those? And my answer to that is that although the data really is promising, as I've described, everything's moving in the right direction. Nevertheless, older Ohioans, particularly those who are unvaccinated, remain very susceptible to severe complications if they become sick with COVID-19. And we know that people who are in congregate living settings, such as our nursing homes and assisted living facilities, and even our older Ohioans who are coming for care during the day in our adult day settings, that's our most vulnerable population in the state. And when we look at the virus, we have to recognize that COVID-19 isn't sitting still. On the heels of the B117 variant that's now dominant in Ohio, we have another highly contagious variant, the so-called Delta variant, which is actually B1617.2, coming into the state. And reports from around the world suggest that this variant is making unvaccinated people sicker faster and is quickly replacing B117 wherever it arrives as the dominant strain. So continuing with COVID-19 precautions, especially in environments like nursing homes, assisted living, and adult day will add another layer of protection to help keep more Ohioans, especially older Ohioans, healthy. Now, the case rate in the general population, as I've referenced, is decreasing, and we're very thankful that we have reached and stayed below 50 cases per 100,000 residents. But progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, is why we're all feeling safer. It's why we are able to take some very welcome steps back towards the life we know, life without masks. However, we still need to take certain precautions in the settings that I've described. Our case rate in the general population has clearly decreased, and we're very thankful for that. It's decreased and it's staying below 50 cases per 100,000, but progress like this, coupled with increasing vaccination rates and decreasing hospitalizations and deaths, that progress, that's what's allowing us to feel safer as we take important steps back toward the life that we have known, life without masks. But we still need to take certain precautions in the settings that I've referenced, in our nursing homes, in our assisted living, and our adult day settings. These are the settings where the population that is at greatest risk from COVID-19, when we look back at the data both in Ohio and across the state, are being cared for. And masks have long been used with success now in not only these settings, but in healthcare settings. And during this pandemic, we have seen just how beneficial masks are in slowing the spread of the disease, particularly among the unvaccinated. Just look at flu and colds. How many people do you know who actually had a flu or a cold this past winter? Not only is it a good practice to wear a mask in a healthcare setting, it's also recommended by the CDC, and it's required by many hospitals and healthcare providers. Now, for those who are unvaccinated, I want to remind everyone that the threat of COVID-19 remains very, very real, especially now with the global rise of the so-called Delta variant. And so we really can't let our guard completely down. If you're not vaccinated against COVID-19, please continue to wear a mask in public. And Ohioans that are able to get vaccinated really should. The COVID-19 vaccines are safe and they are effective. They don't contain tracking chips. They don't change your DNA or impact your fertility or magnetize you. What they do is protect you and others from getting COVID-19. Now, staff and residents in our nursing homes, in our assisted living, in our adult day settings who haven't yet been vaccinated really should talk to their doctor to learn more about the COVID-19 vaccines. Congregate living environments are really special environments where we need to care for and do care for some of the people who are most vulnerable to COVID-19. So in these facilities, we need to be especially careful about creating a COVID safe environment. In addition to taking precautions like washing your hands and wearing a mask, you should take extra care to think about how you can help us limit the spread of COVID-19 in the care environment where you work. So, for example, should we be cohorting residents who are ill or test positive for COVID-19? Of course, we should. What else can we be doing in the environment where you work to keep the people you're caring for and working with safe from this virus? A virus which, as we look back over the pandemic, has taken a very severe toll, certainly on the population of Ohio as a whole, but especially on our older citizens. So remember the important role that all of us play in helping to decrease the risk of spread of this virus, a virus which we're beginning to win the battle against, but a virus which is certainly still with us and which we still need to think about as we get up each day to go into our workplaces and care for some of the most vulnerable Ohioans.
So, Dr. Vanderhoff, I do appreciate you walking us through that very important information. And I think what I find most fascinating is the importance of understanding the difference between some of the guidance that has come out for the general population and why we have to be especially vigilant within these congregate settings. Can you speak to that just again for a moment?
Absolutely. So when the CDC came out with its guidance regarding what we can do safely when we are vaccinated, it was really addressing how we live our lives in more public settings. And there's no question that when we are vaccinated, we are very safe in terms of our risk of getting COVID-19 and even of transmitting COVID-19 to other people generally. But we know from our experience throughout this pandemic that certain settings pose a much greater risk for the transmission of SARS-CoV-2, the virus that causes COVID-19, and for the population that either lives in that environment or is served in that environment. And of course, some of the environments where we have to be the most careful are those where we are caring for our older Ohioans, or our older Ohioans are residing, our nursing homes, our assisted living environments, and our adult day settings. Those are settings where the guidance, along with the guidance for healthcare coming from the CDC, continues to point to the importance of COVID safety measures, including masking. The mask remains a very effective measure for us to help decrease the risk of the spread of this virus. So, thankfully, at this stage in the pandemic, we can feel really good about getting vaccinated and the safety that the vaccine provides us. But we have to remember that when we are in these environments where we are caring for vulnerable people, we have to take extra care and be extra careful. So one of the points I think it's important for us to remember is that the COVID-19 pandemic continues to evolve. It continues to change. And so therefore, the guidance, the healthcare guidance that we need to be mindful of will continue to evolve along with it. Our best guide for understanding what we need to do to keep each other safe is the CDC. And so I would encourage you, as this continues to move ahead, to look towards the guidance that the CDC provides regarding the environment in which you work, whether that's a nursing home, an assisted living facility, an adult day setting. The CDC will continue to be our best guide.
So, thank you for joining us today, Dr. Vanderhoff. We do appreciate your time and expertise.
Well, thank you very much, Director McElroy. I want to express my sincere appreciation and the Department of Health's appreciation for your leadership, as well as for all the wonderful work that so many Ohioans who are involved in every day in the care of older Ohioans have offered throughout this pandemic. Your hard work has really made a difference, and there's no question in my mind that the efforts of people in our nursing homes, our assisted living, and our adult day settings have made a difference in the health and the lives of Ohioans throughout this pandemic. So I'm very appreciative, as I know all the members of the Department of Health are, for the work of our Department of Aging and people in the elder sector.
I am grateful for the opportunity to provide information to Ohio's assisted living providers. With the state of Ohio opening back up, we must remain vigilant in our infection control practices. We should use reputable sources of information to continue to frame facility policies and procedures, even with the state of Ohio public health orders being lifted. Each residential care facility shall establish and implement appropriate written policies and procedures to control the development and transmission of infections and diseases. We would expect RCFs to take under advisement recommendations made by the CDC or other reputable entities in the development of these policies and procedures to ensure proper infection control measures are in place. It is so important to remember to get back to the basics. Remind staff of proper hygiene, the importance of social distancing, and wearing proper PPE when needed. Remind staff, even if COVID-19 isn't in the building, they should continue to follow all infection control policies and procedures to ensure state licensure requirements are met. Thank you again for the opportunity to speak with all of you.
Thank you. It's a privilege to address you, the staff who are committed to the seniors who depend on Ohio's assisted living facilities. As a physician who has cared for patients just like those who have benefited from the services you provide, I cannot put into words the appreciation that I have for what you do every day. This has been an extraordinary 15 months since the beginning of the COVID-19 pandemic. I have personally experienced the loss of patients I have cared for years. I've seen staff members who became ill with COVID and reached out to me for advice and medication. I've had family members who worried that I might bring the virus home to them. I've worn the masks and the face shields, the gowns, used tons of hand sanitizer, performed nasal swabs on other people and myself for over a year. So now that we are passing into this next phase of the pandemic, I'm excited about the prospects of returning to a life that is similar to what I remember prior to March 10th, 2020. I understand that it can be similar and that it will be similar, but it won't be the same. So yesterday I went to this grocery store and I could have bought as much toilet paper as I would have wanted. I actually saw Clorox wipes and Purell on the shelves. I can now visit my 85-year-old in-laws because we're all vaccinated. I can go to church or a concert or a Cleveland Indians game. Over the past year, I've learned so much about appreciating little things in life and the relationships that went away during the height of the pandemic. There are other things that I've learned this past year that everybody deserves grace, understanding, and patience. And make no mistake, the pandemic has affected all of us in ways that we may not realize. I've learned that over the course of the day, when I ask people how they're doing, and they pause and they look out at the horizon and they say, I'm fine, that likely means that fine means feelings inside not expressed. So we're entering this new phase of the COVID-19 pandemic. And in fact, I've heard some people this past weekend say that they thought the pandemic was over. There are very few statements that I can say with certainty as a physician, and one of them is that the pandemic is not over. COVID is still in our communities. It is among us. And until the entire world can have the opportunity to be vaccinated like we have here in Ohio, the pandemic will continue to be a threat. Over the next days and weeks, it may seem like that threat has passed. We've been unwinding the requirements and policies that assisted living facilities have been living with for over the past 12 plus months. We will eventually be told that this is no longer an emergency. Nonetheless, the same virus that has disproportionately taken a toll on you, your peers, and the population we care for remains in our communities and among us. We now have at our disposal an abundance of safe and extremely effective vaccines that, if accepted globally, would end this pandemic. In the meantime, the virus continues to make millions and billions of little virus babies, and every once in a while, one of those babies is not quite the same, not quite so perfect as its parent. It's a variant. And eventually, one of these variants will be just different enough that the vaccines will not be as effective, and we could slip back into the outbreaks like we experienced last fall. We can prevent this from happening through vaccination and continuing to practice all the tried and true methods of infection prevention like hand washing and hygiene, wearing masks, especially around those vulnerable population, including the unvaccinated, and cleaning up after ourselves through sanitization of hard surfaces. Each of you need to decide to continue these practices through the remainder of the pandemic, even if the Ohio Department of Health or Governor Dewine or the Ohio legislature rescinds the mandate to do so. Testing and infection prevention and control needs to be a part of what we continue to do every day for the rest of the pandemic, even if we're not told we have to. This now becomes our responsibility. It's kind of like the analogy of school. We've made it through the elementary school portion of the pandemic where everything is laid out for us and we just have to follow the directions. We're now entering college, where we get to choose what classes we take and what path we follow. The Regional Rapid Response Assistance Program, or RAP program, for which I serve as the Chief Medical Officer, stands ready to support you and your organization through these next important months. The state of Ohio will continue to provide testing supplies like rapid antigen tests, PCR testing, and vaccinations against COVID-19. If you go back to the metaphor that we're entering this college phase of the pandemic, think of the RAP program as that guidance counselor that was always there to help get you through your schooling. The program is supported through the Department of Aging with money allocated to fight the pandemic. We have 8 regional medical directors, some of whom will be answering questions in just a few minutes. These medical directors want to help you and your team, and in some of your cases, your medical director, when questions arise about testing or management of COVID outbreaks or anything COVID. We have contracted with an organization of content experts in infection prevention who is available to you and your organization for COVID prevention and control, testing strategies, and to provide another voice to educate about the value and importance of vaccination acceptance. In medicine, we call this a curbside consult or a second opinion. And this is available to your organization at no cost to you. RAP has a call center that is available Monday through Friday from 7 a.m. until 7 p.m. Please reach out to RAP for assistance. We also have been making outreach calls to facilities like yours who may be experiencing COVID outbreaks to introduce the program and to verify the accuracy of the information reported to the Ohio Department of Health by local health departments. If you get a call from the RAP program, please accept it and understand that we're here to provide this valuable service and support to you. The most important aspect of the RAP program is that it is at no cost to you. It can save you time, it can let you concentrate on the services that you want to be providing, and very likely the RAP program could decrease illness and loss of life in the coming months. Thank you. I'd like to introduce our panel, and they will be taking some questions here in a couple minutes. What we'll do is I'll call on each of you if you can do a short introduction of yourself, where you live and how you've been involved with the RAP program or in COVID in general. That would be terrific. And then I'm going to ask each of you to answer the same question, and I'll give you a pass on this, Rebecca. But at least all the physicians, I'm going to ask them the same question, which is, as we enter this new phase of the pandemic, what do you think are the opportunities and risks for assisted living facilities over the next couple of months as the requirements are peeled away? And so we'll start with Dr. Lehner. Thanks for joining us. You've been instrumental in the functioning of the RAP program. Can you introduce yourself? And I'll give you the first opportunity to address the opportunities and risks for assisted living facilities.
Good morning, Dr. Wigand, and I'd like to thank Director McElroy for allowing me to present today and speak to all of you. So I'm a physician. I work in long-term care. I'm a medical director as well as a physician that sees patients. I'm also the regional medical director for Region 1 for the RAP program. I live in Medina County and I'm on the Board of Health, and I went to a meeting last night and it occurred to me that this is the first time in 15 months that I've been able to go into a room with my Board of Health colleagues and not wear a mask. And we sat not quite next to each other like we used to, but it was closer than we have been for the last almost year and a quarter. We had a guest last night, and that individual indicated that the pandemic was over, and thank goodness that's happening. And it occurred to me that I think that's perhaps a trap that we all might fall into over time, to thinking that as the relaxation of some of the requirements takes place, that we could believe, or certainly our families that come visit our residents could think that, oh, thank goodness it's over, we can relax now. And as you've heard through other speakers this morning, that couldn't be further from the truth. The pandemic is not over, the virus is not gone, and it's out there looming and waiting to find a home in one of our residents or perhaps yourself, especially if you're not vaccinated. So how did we get here today versus a year ago? A year ago with lockdowns, businesses being closed, many of us working from home, myself included, except for when I was out seeing my patients. And here we are today. We're opening things up. We're able to go into our facilities and see families that we haven't seen for a year, et cetera. Part of that and most of that success is due to the vaccination. And you've heard a lot about vaccines this morning, and I'm going to take this opportunity to encourage you and your staff and their families to get vaccinated. That's certainly very, very important. But the other things we've done for the last year is the simple things, the things that we have been harped at about, but hand washing, hand hygiene is very important. Monitoring our staff, our residents and patients and their families for symptoms and signs of illness, encouraging them, and if they don't feel well, consider getting tested, but certainly stay home. If you're unvaccinated, you need to wear a mask. Those are things, again, I think that we've been doing for a year, and we can't relax on those things. And we have to strike a balance between relaxation, and doing the things that make sense to keep ourselves, our families, and in particular our residents safe. As you heard, washing the frequently touched surfaces, bedside tables, handrails, nursing station desks, etc. Thoughtful use of masks we've talked about, especially if you're not vaccinated. Protect yourself, protect your family, and certainly protect our residents. And then social distancing as it's appropriate as the weather warms up. And of course, it's not too warm in Northeast Ohio today, but it's going to be warmer later in the week, and perhaps socializing outside is a good opportunity now that the weather's getting warmer. I don't need to remind most of you that those patients that live in memory care units and behavioral health units have also been hardest hit in some of these pandemics because they don't understand social distancing. They certainly don't tolerate a mask in many cases, and the filters of personal space are usually gone. So they tend to touch more things and more people than somebody who isn't mentally impaired. So I would encourage you to continue the practices of infection prevention that you've done for the last year and a quarter, and please get a vaccination if it's possible. Thanks.
Thanks, Dr. Lehner. Dr. Haller, you've been a tour de force with the RAP program. Anything I've asked her to do, she's done, and then some. So can you introduce yourself and also kind of explain what your thoughts are regarding the risks and benefits moving forward?
Sure. So thank you so much for the opportunity to be a panelist. And Dr. Wigan, thank you, Director McElroy. Excuse me. And, it's certainly an honor to serve Ohioans and be a part of the RAP program. I practice in Southern Ohio. I'm the medical director for several facilities. And we have certainly all been impacted by COVID-19. So, one of the things is that we know that vaccinations have clearly made a difference in preventing outbreaks in the congregate care settings. The RAP program has done outreach, and we have noted that in the facilities that those that have less than 45% of their staff being fully vaccinated continue to have increased numbers in outbreaks of residents and of staff, regardless of their vaccination status. So in other words, if less than 45% of the staff are vaccinated with and the vaccination, the COVID-19 vaccination, the COVID-19 continues to enter the facilities and affect both the vaccinated and the unvaccinated residents. The really good news about the vaccination, though, are the fact that the individuals who are vaccinated, whether it's staff or the residents or even the physicians and providers who come in the facilities, rarely do they have significant symptoms. They almost always have minimal symptoms, and so that just proves the effectiveness of getting the vaccine. So, the importance of risk reduction, is vital for yourself, for others, for the residents, for staff. And I just really want to encourage everyone to get vaccinated. Reach out to the RAP program. We have so many different resources with regards to education for your staff and vaccinations. I know I personally have done in-services for some of the facilities, both virtually and in person. And, just to reiterate what Dr. Wigan said, what Dr. Vanderhoff has said, what Dr. Lehner has said, the threat of COVID-19 is still very real. And, it's really not over. So please get vaccinated. Encourage others to do the same. And I just want to reiterate, too, that the vaccine is safe.
Thanks, Marla. Dr. McLean, it's always great to have you on these panels. I appreciate you being here today. What are your thoughts?
Thanks, John. I'm happy to be here. I also work in medical director space and skilled and assisted living, and privileged to be part of the Department of Aging's RAP program. And we've had so much change put on us with this virus, and now we're on another piece of change. with going from, I thought your example from elementary school to college was excellent. So with that amount of responsibility, I've had over the past month, especially, an opportunity to speak with so many of you in assisted living. And regarding testing, there's been a wide range of opinion from thank God we have it because we're picking up asymptomatic individuals and keeping people safe, to far on the other end. This seems like a nuisance and it's difficult on our staff or even difficult to staff, and lots in the middle. But as we look at the recommendations for continuing from a surveillance standpoint, testing our individuals that are not vaccinated twice a week, we have to remember that when we had a lower cadence of testing was when we had the highest explosion in assisted living world of cases and significant loss of life. I would also like to speak to the symptomatic testing. And we know from this virus that the symptoms can be almost anything. And it's easy to kind of blow things off and say, well, this is just pollen, or it's this, that, or the other. I'm tired from not sleeping well last night, whatever. If you have any symptoms, if your staff has any at all, test. It's easy. It gives you the opportunity to stop spread without happening. And we have lots of things that we don't know about the future with COVID, but there are some very important things that we do know. We know that it continues to be a very dangerous virus, especially in our settings. We know that it continues to be very contagious in unvaccinated, actually more contagious than it had been previously. And we know that we also, with some vaccine hesitancy, are not at the spot that we would all like to be to end this pandemic from vaccination. So I just encourage everybody to continue to talk up the vaccine, get as many people as we can. It's not over yet, it's not done. And the other aspect as far as testing, because there are lots of whys and questions, and I hope that this has given some information through everyone on this panel on why it's still so important to keep that tool going forward until we're on the other side of this. So thanks for letting me be with you.
Thanks, Dr. McLean. And last but not least, Dr. Jump, it's always a pleasure to have your perspective as an infectious disease specialist. And so after introducing yourself, I'll give you the unenviable task of answering the same question a fourth time. So if there's anything else that you can impart, that would be appreciated.
Sure. Good morning, everybody, and thanks for having me join you today. So I'm an infectious disease physician, and I work in the long-term care space doing infectious disease consults in our long-term care settings. I work at the VA hospital in Cleveland, so I get to see the spectrum of going across from outpatient and inpatient and long-term care. I was recently on service on the inpatient side, and we had a few patients come in with COVID-19 infection. And I also managed some of the outpatient elements as well. So let me tell you about the 3 patients that I experienced over the course of a long weekend at the VA. We had one gentleman who was in his mid-60s. He is a renal transplant recipient, so he's immunosuppressed. He had received his COVID vaccine back in January, like a lot of our veterans did. And he actually did wind up getting a COVID infection. And he was admitted to the hospital mostly as a precaution. And he went home the next day. And he went home fine. He was eating, he was drinking, he was breathing room air. And we were all glad that things were looking so good. And he's still doing fine. We had a 92-ish-year-old gentleman come in. He had also been vaccinated. He had acquired COVID and it was a mild infection. And what he really came in for was supportive care. He needed some fluids and a little bit of rest. And he went home 2 days later. He did not need oxygen. He did not need steroids. He did not need monoclonal antibodies. He just needed a little bit of, what amounted to chicken soup and a warm blanket, and we got him home well. The other gentleman was a 45-year-old healthy individual without any big medical comorbidities. And he actually did not get his COVID vaccine. He went to a non-VA hospital. Sorry, this is how we speak in my world. Went to a community hospital, and I was aware of his admission, and then I was aware of his discharge a week later, because I had to help make arrangements for him to go home on oxygen, and he's still on oxygen. And had he gotten the COVID-19 vaccine, he would not have had to go through that. And it wasn't just him, it's actually his wife is also pretty ill with COVID, and she's also not doing great. She's in worse shape than he is. And I think that it was his grandchild, like a young grandchild, was also sick with COVID. So all very avoidable with the vaccine. So what I'm seeing over and over again is that people that have the vaccine, and some of us will still get COVID after getting a vaccine, it's mild and we're well and we don't spread it. And for people that aren't vaccinated, they get sick and hospitalized and their life is really disrupted. And as we all know, there's lots of long-term consequences to COVID, and we can't always predict who's going to suffer those and who isn't. So I also encourage you from the bottom of my heart to please, if you're not, please get vaccinated. And if you are vaccinated, good for you. And please tell all your friends to go get vaccinated too. So with regard to what we can also do about what we're seeing when we get people that have a COVID-19 infection after having been vaccinated, I would like to suggest or request that if you're seeing that and where you work or where you reside, please get those isolates sent out for PCR sequencing, because you heard Dr. Vanderhoff speak about the different variants that we're having. This is how we keep track of how the variants are spreading across Ohio. We have very little information about what's happening in assisted living and long-term care with regard to the variants, and we really need to have that information that helps us anticipate and predict and stay a few steps ahead of the variants coming across. We know that some of these newer variants are more contagious and they can cause more severe illness. And over again, what we're seeing is that people that have been vaccinated don't get nearly as sick and aren't nearly as contagious. And so again, the vaccine is really important to prevent this. So, and I'll stop there. Thank you.
Great, thank you. And just kind of dovetailing on that, the WRAP program, as was mentioned before, has reached out and called a number of facilities, not only assisted living, but nursing facilities. I think over 70 have been contacted, and of those, we've had about 240 cases of COVID, and about 50-50 have been vaccinated. And what was interesting is none, that's the amazing number, 0, had actually been sent samples, PCR samples, to the Department of Health, which is what we would like you to do. The Department of Health will accept those, can be facilitated through the WRAP program, or it could be facilitated through your local health department. Sometimes the health department is pretty busy doing other things, and so they may be hesitant to be able to reach out and help you. So call the WRAP program, because we do want to get that surveillance to do the genomic testing so that we have eyes on what's going on in facilities in regard to some of the variants. So, and with that, I think we'll go ahead and open it up to questions. I think Director McElroy is going to present some questions, and we'll ask different panel members to respond.
Okay, all right. So there are several. I'm going to try to cluster them based on the topics and try to stay true to the questions as they are posed. So the one question is, do you have evidence that testing twice weekly is more effective as it is not required by the CDC? And I think before, and I'd like to have a few of you answer this, I think one of the things you mentioned, Dr. Wigan, which is really important, is that we are transitioning from sort of the elementary or early school into more of the college years. And so we're not, I guess, limited now to what is required as much as understanding and appreciating what will work best to keep our residents and staff safe. So while the question blends the two, I think it's important to make the point on this is now our opportunity to do those things that we know work. And so if someone else wants to weigh in on this about twice a week, the question is specific to twice weekly. How do we know it's effective?
Yeah, Dr. Jump, do you want to answer that question? And then we'll open it up for others.
Sure. Thank you. And sorry for, it still takes me a while to unmute sometimes. So, you know, we're still in a state where we have to have an abundance of caution. And part of the reason why the frequency of testing is what it is because the vaccination rate among Ohioans in general is not where it should be. With more vaccination and better control of the spread of the virus, I think that we can anticipate and look forward to a decreased cadence of testing. And bear in mind that part of what has to happen here is that every time that we get a positive test, it leads to quarantine for the facility until we have a 2-week period without positive testing or new cases. And that's a huge detriment to our residents. It's not even just this, it's not only the threat of illness, it's also the threat of going back into isolation for such a long time. That's really hard on everybody. And I know that's the similar situation for assisted living too. So it does make a difference, it does matter. And the idea is that we can get on top of these outbreaks as fast as possible as well. And we are seeing outbreaks in among older adults in institutionalized settings. Thanks.
Yeah, so Dr. McLean, I'll just ask you what you think about the effectiveness of doing a once a month test for surveillance for COVID.
There is not any effectiveness of doing it once a month. It's kind of like playing the lottery at that point, whether you're going to hit someone or not. And really, again, in the corridor that we're in right now, with appropriately opening up to visitation, and especially younger individuals who are not currently in the realm of being able to be vaccinated, but can transmit the virus, we're at a very high risk point right now for these elderly individuals. So twice a week, while not perfect, certainly gives us a much better ability to stop a widespread infection throughout the congregate setting, and to keep really not just the residents, but other staff members safe as well. And I completely concur with Dr. Jump that the problem remains that we do not have adequate acceptance of vaccine to be in an environment of safety. So please continue to encourage all of your staff who are not vaccinated to get vaccinated so that we don't have to do this.
Dr. Lehner, Dr. Haller, I don't know if you have anything to add to those two opinions.
Just one additional comment is that we know that a lot of times the vector of the virus into the facility is somebody who does not have symptoms, or they're not expressing them, or they're calling them a cold or allergies or whatever it is. So by testing, we're going to identify those people that may be minimally or not symptomatic and stop that and limit that outbreak in the event that they are positive. So I think is a good reason to test more frequently.
Yeah, I guess going back to the analogy of college, you know, when what I found to be the most effective way to prepare for a test was to do my own test, to quiz myself or have somebody quiz me before the college quizzed me. And that's really what I think what we're asking you to do is to take that responsibility. And it is, it's up to you from the standpoint, obviously, of coming up with your own strategy. Yeah, twice a week for unvaccinated individuals is kind of where we are right now. But when you have an outbreak, we ask you to do what's the right thing, in testing those around the outbreak. That came up this week for me when a facility that I help out asked, what do we do about screening for symptoms of our independent living? It was a facility that had independent living as well as assisted living all on one campus. And they'd been asking, the independent living people, whether or not they were having any symptoms every day, which, I told them I didn't think that was necessary. But if there was an outbreak on that campus, then it would make sense to me to start doing that again. And that's not anything that, Rebecca is going to ask you, or you're going to hear from the CDC or CMS. It just makes good sense. And that's really, I think, what the message is that just do the things that make good sense.
Okay, so here's a question. If it is not known how long someone is protected from COVID when vaccinated, how do we know there are no long-term effects from the vaccine?
Dr. Lehner, do you want to take that one? And we can always pivot to Dr. Jump.
Yeah, I'll start, but I'm happy to hand the baton off to Dr. Jump. What we know so far is, and we've been doing vaccinations now for a little over 6 months, and we know that, and prior to that, there was the testing by Moderna and Pfizer, that the side effect rate was very, very low, and to the extent that it's safe for the elderly, it's safe for the people that have multiple comorbidities, also safe for pregnant women. So we have not seen any reports of significant reaction to the vaccine, with the exception of Janssen, and that was held for just a short time and then released back into the market for use, because it was determined, even though there were some untoward side effects, it turned out to be a very safe vaccine, and the benefit certainly outweighed the risk. So, but Dr. Jump, I'll let you take that. This is probably your area of expertise more than mine.
Sure, thank you. So I hear this a lot. What are the long-term side effects of the vaccine? And technically, I can't say that we know what those are going to be, because we've only had the vaccine around for like a year against COVID, or not even a year at this point. However, for all the other vaccines that we have, when there's side effects, they happen right away. And by 2 weeks, we're done. And then the long-term benefit is immunity and the immune response. Some of immune responses do fade over time. And we may have to, just like we have for many other things, have to get a booster for COVID. And that's fine. It's necessary to help protect ourselves and our health. Where we do know that there are long-term side effects is with COVID, the disease. The disease is really bad. This is where we see people with this brain fog, with long-term inflammatory side effects, where they just don't feel well for weeks to months after getting the actual infection. And this is a no-brainer to me. I would so much rather have 2 days of feeling a little oogie after I got my vaccine, which I did. I couldn't get out of bed for 2 days. And then all at once I was like, oh, I'm better. I would so much rather go through that again than go through the actual illness. In terms of how long the immunity lasts, we'll find out. We're all going to find out together. Those are ongoing studies that, including, I'm enrolled in the Pfizer vaccine trials. So they draw my blood every now and again and look to see what my antibody levels are. And that's a very active area of research. We'll find out. It's okay. We don't have to know everything, but we know that the vaccine works, it's effective, and it is safe, and a heck of a lot safer than getting sick with COVID.
And Dr. Jump, so far so good on the neutralizing antibodies? from those studies, that as far as we know, right?
Yeah, and these, it seems to last for quite a while. So, and this is part of what we know about vaccines. So those of you that have had the shingles vaccine, you may have experienced some pretty notable side effects from that too, in the immediate response after you're getting it. And that actually speaks to the effectiveness of the vaccine. If a good vaccine makes you feel a little sick because it's your immune response kicking in and doing all the things it's supposed to do to protect us from getting ill. So this is actually what we want. I mean, I was really happy I got those fevers, which sounds so perverse, but that's where it was.
I want to pivot for a moment here, and Rebecca, I'll give you the first crack at this particular question. It's, can we trust the visitors to screen themselves? That is, take their own temperature, wash hands, have a mask on, and complete the screening form. Or does the staff member have to complete this? Your thoughts on that?
Well, I have two different thoughts on that. One, I think it's definitely important to trust that the individuals that are coming into your facilities to visit their loved ones are doing everything they can to protect themselves, and they themselves are screening for temperature, for symptoms. But I also encourage facilities to be diligent about it and verify that it was done. And, if they feel more comfortable screening those visitors, then, by all means, please do so.
Dr. Haller, do you want to go for that one as well?
So, it's really up to the facilities. Rebecca talked earlier about the facilities developing their own policies and procedures. I would just encourage that for everyone who's listening to this webinar and who is going to educate their staff and talk to their families, that the majority of families that I talk to are certainly willing to be screened. Some of them readily want to show their vaccination card, even keep a copy of it on file. So we're just getting a myriad of comments from families. But I certainly would offer the option. I mean, that's a personal opinion, but I think it's vitally important for everybody to remain safe. And it was interesting past week.
Sounds like we might be losing Dr. Haller.
I did individual Hunter has not.
Yeah, I think we lost Dr. Haller. So we'll why don't we move on to the next question?
Okay, all right. So the next one is, make sure we get a good one here. The question is around the limits on the number of visitors coming in. Do they still have to limit the number of visitors, and do the visitors still have to be scheduled? This goes to the earlier point that was made in the presentation that effective June 18th, that the order that governed the visitation for the assisted living facilities or the residential care facilities has been rescinded. So at this time, the facility would have to, within their visitation policy, determine how they would handle that. That is, how many they would have, if they require people to schedule or not. Again, you just want to be mindful of the capacity and flow, that you can do it in a way that you can safely manage it. And I don't know if others have comments on that.
Yeah, I guess I'd open that up for anybody. What are circumstances in this day and age that would maybe cause a assisted living facility to maybe take a step back and think about, okay, there's maybe a flare up in our county or something like that? Are there other things, I guess, that would cause them to maybe think about making their own decision about a change in visitation? I'll just open it up. Maybe we lost everybody. I don't know.
Dawn, can you hear me now?
Yeah.
I apologize. This is Dr. Haller. So I think I'm having a little connectivity issue, and it actually started before the webinar. So I apologize for the technical difficulties. But I think one of the I guess thoughts is that if you end up having a resident who is COVID positive and the severity of their illness, I think that would certainly alarm the staff, those in the leadership roles, your medical director of the assisted living, and want to further enhance your policies and procedures with regards to testing. And certainly, even as I said, I've promoted vaccinations this morning because I think we need to be diligent, with that. So I think the severity of illness in an individual who would be positive would certainly be impactful. And certainly if that patient did not have a good outcome.
Yeah, I think the other point that I think is important is that only you know your facility and the environment that you're in, the physical layout of the facility. And the WRAP program has this resource of infection preventionists that you might just have a question of, gosh, we're wondering if maybe we need to rethink what our visitation policy is, but we want to get a second opinion about that. That would be a great resource for you to just call. It doesn't cost anything. They will kind of listen to what it is that your concerns might be, and they can help advise whether or not you need to make some considerations. So just once again, you have all these resources at your fingertips. You just have to let your fingers dial the number for the WRAP program.
So there are several questions, again, related to if you have to escort people to their rooms, the ages of individuals that can come to visit, how long they can visit. Again, I think these go to some of the visitation policies and some of the decisions that you will have to make based upon your physical layout. But with the idea, you would do so understanding that there is really good guidance from the CDC on how this can be done safely. Again, you heard Dr. Wigan mention the response team, the Regional Rapid Assistance Program. We would encourage you to reach out to RAP if you have questions about layout, if you have questions about good infection prevention and control practices, if you need that consultation to happen either virtually or even on site, we encourage you to reach out to help you with some of these questions. But as it relates to the order is no longer in place. And so those requirements on age limits, those requirements on how many, the length of the visit, escorting individuals to the room are no longer in place. It doesn't mean there aren't good practices that you can still continue to have. It doesn't mean that there aren't other things that perhaps you want to put in place, but the order on how those visits must happen is no longer in place, and that was removed effective June 18th.
I wondered if any of the other panelists wanted to respond to those, really very specific type things, what you'd recommend in those circumstances, besides, the WRAP program.
I would recommend just using common sense. Think about, do you have enough opportunity to provide hand hygiene? Can you clean the hard surfaces after the guests leave or in between visits? Those kinds of things, and how small or how big are the areas or area that you're going to use the visitation. As Dr. Wigan said, you know your facilities better than any of us, but if somebody were to ask, I would suggest it's just have to take a look at what you can provide safely for your residents and for your staff and for your visitors as well. As the weather gets warmer, perhaps if you're going to have a large group of visitors, a family, let's say for a birthday or something, perhaps outside is the best opportunity for a large group. So to me, it's just common sense and just trying to think about the big picture and how can you keep everybody safe.
There's one other comment. I know we're getting down to a couple of minutes, but I do want to hit this. I think there's a comment that I would like some response to. It says, going above and beyond seems punitive when it is only in these settings. The comment is, are prisons, daycares, and others being asked or required to test above the CDC recommendations? If there's a comment to that, or
I could comment on that, because all of us that work and live in the assisted living world, really it's assisted living is better living, and we're trying to provide the best quality of life for the folks that reside there. And that includes being able to visit with family and loved ones and do more normal things of life. And unfortunately, when there is an outbreak in a building, that significantly decreases the ability for us to do those good things we're trying to do. So that's the reason of the ask of increased surveillance. And the other piece is that our people, while certainly wonderful to have them in our facilities, they are by definition the highest risk for bad outcome from this virus.
If I can chime in, the mortality among nursing home residents was up 32% this last year due to COVID. I don't have numbers on assisted living, but I can guess that it's a pretty similar number. That's a lot. And so the masking, the above and beyond, the testing seems like a very reasonable thing to help prevent death and disability among our residents and among our staff. Thanks.
One comment before, kind of about the questions that happened before is not all assisted living facilities have medical directors. But certainly if you do, we certainly would recommend that you ask your local physician, who's your medical director, to help weigh in on some of the thoughts that you have regarding specific policies at your facility. And if you don't have a medical director, you're not required, but you do have doctors that come in, and I suspect that those physicians who take care of some of the patients in your assisted living would be happy to talk with you about that if you haven't asked. I'm sure a number of you do ask those questions, but I think once again, it's just one resource. And we in the WRAP program, we have regional medical directors, 8 of them, who are willing to help talk with physicians in your facility or the facility about some of those types of specific questions.
so I know we are at time, but there's one last comment I think is really important before we go. And it is, I think it's a very straightforward comment and one that others may have in mind. From speaking with colleagues, there is hesitancy related to reaching out to WRAP for fear of retaliation from the Department of Aging, the Department of Health, as the increased scrutiny of infection control and punitive nature of the departments. Can you address this concern with the group?
I don't want to beat a dead horse regarding, the analogy of college, but I will. The reality is that sometimes it's helpful to bring in a tutor. The tutor doesn't necessarily talk to the professor who's providing the test. And the bottom line is that the WRAP program has been set up to be supportive, not punitive. We're supportive. And we've made very specific ways of trying to silo ourselves, to be just a support. And, even in some of these calls that we've made, we spend the first 5 or 10 minutes explaining that this information that we're trying to get is really to try to get a sense for two things, obviously to make sure the information that we're receiving is accurate. And sometimes it hasn't been necessarily accurate. So it's great for us to be able to do that, because then we can go back to the Department of Health and say, gosh, this seems like it was over-reported. And we've been able to hone that over the course of the last several months of gaining that information. And then secondly, I think the benefit is that we can aggregate that information, which is what, some of the information that we've provided today is we aggregate that to get an idea of a little bit of an idea what's going on within the state and in your different environments, and what we can do together to better inform all of you of how we move forward. It's really to be a resource more than anything. And so I guess that would be my plea from the standpoint of what the WRAP program is really meant to do. It's not meant to be punitive at all. It's meant to be supportive.
Dr. Wigand, if I can, I'd also like to add on there from the health department's perspective. Dr. Wigand and I do have conversations, because when we first started with COVID, we worked very closely together in Zone 2. But as far as the WRAP team, I don't know the facilities that his team is working with or anything like that. So from a punitive standpoint, if you ask for help, I have no idea who those individuals are. And we wouldn't do that. I think it's important, when we identify things on survey from complaints, there's oftentimes that Dr. Wigand and I will talk, and I will say, look, we're seeing these things, and that helps him then direct guidance and information and technical assistance to all of you. So it's definitely been a collaborative effort, but one also where, like he said, there's the silo that we do not know about or don't participate in. So I would like to put your mind at ease in regards to that.
So thank you both, and thank you all for being wonderful panelists, and thank you all for attending today. We hope that you found this information informative and know that and helpful. We will have this information posted on our website at aging.ohio.gov. There'll be a recording of this webinar, again, with the supporting documentation that was referenced here today. So we thank you for all you've been doing and all that you will continue to do. And we hope you enjoy the rest of your day.